Okay, good morning, everyone. Welcome to TeleShadowing. We are live on YouTube. We're so excited to welcome Dr. Mohammed Zeshan today to today's session. Dr. Zeshan is a board-certified psychiatrist with specialized training in both adult and child psychiatry. He currently serves as a clinical assistant professor of psychiatry at Rutgers, New Jersey Medical School, where he's deeply involved in educating medical students, residents, and psychologists nationally and internationally. An international medical graduate from Pakistan, Dr. Zishan completed his psychiatry residency at Mount Sinai Bronx Care, followed by a child psychiatry fellowship at Harvard Medical School, Boston Children's Hospital. He's also trained in infant parent mental health and newborn behavioral observation with over a dozen peer reviewed publications to his name. He is also a published author, and beyond his academic work, Dr. Zishan is a certified master parenting coach and Maxwell leadership coach. Through his clinical care, coaching, and advocacy, he helps parents and families grow with confidence, compassion, and connection, especially in the digital age. And we're so honored to learn from him today. Dr. Zishan, you can begin today's session. Thank you.
Thank you so much, Amna, for such a generous introduction. And thank you so much, Dr. Asma Chima, for inviting me. And I think more than that is just to have this space where, a lot of what I learned about, there are undergrad, there are graduate students, there are physicians. So people across, different age groups work together and try to learn from each other, because I feel and strongly believe that we have so much to offer if we have that platform where people feel being heard, being understood without being judged and without being labeled right and wrong, or this is the old way of doing things, this is the new way of doing things. So I'm so happy and just want to congratulate TeleShadowing team for providing this opportunity. So, as so my main topic is on digital and detoxification, swipe, scroll, sleep, reclaiming the teenage mind in a digital age. And it's ironic, that we are doing it on a social media platform. So one thing I want to say it out loud: social media, video games, or any uh, kind of screens, what we call in a broader term, they are not bad itself. They become bad when we achieve everything, and I will go over what I mean achieve everything. I know it's early in the morning, so one thing, if you don't have coffee, please have it, because I will ask you to keep remember few words, and so that then I will, and I will remind when you go over. So one thing you need to remember, I think need is a strong word. One thing I will encourage you to remember is these five S's. What, why, I am saying that these screens, these phones, these video game, and all those things are not addictive or not bad itself, but what make it bad, what make it addict. Because nowadays, the other thing, I'm a child psychiatrist, board certified, I have private practice, teach students, and many time, and a parenting coach, many time in my coaching session, in my one-to-one interaction with parents, teenagers. One thing is, parents and teenager and young adult who just labeled ourselves screen addicts, we just identify ourselves, so hopefully today I will be able to share why we use it, and what is the difference between so-called screen addict, although honestly I don't like that term, and I will explain that as well why, and what differentiate what is a normal use in different age group. So before we dive deep into the screen addiction, let me just go over a little bit about the neuroscience. So Dr. Dan Siegel, again, he has a lot of good YouTube videos, lot of great books as well. So he showed this hand model of the brain, where he says, like, let's say this is the hand, these fingers are our thinking brain, which is behind our forehead. The part of the brain that we call prefrontal cortex, which means that, the thinking, planning, organizing. And the palm is an emotional part of the brain, which is the fight and flight. So in a normal situation like this, like let's say today, our thinking brain is covering our emotional brain like this. Okay. So you may be upset, you may be mad. Let's say, you may be upset at Dr. Chima, why she has to call this screen addiction on Saturday morning on such a short notice. But your thinking brain will say, okay, not today. Don't say, anything. So we will talk to her maybe later on, but not now, because the thinking brain is telling you, Dr. Zishan is presenting. He seemed like a nice guy. So let's not make things complicated. So the thinking brain covers the emotional brain and keep reminding, not now, maybe later on. So that is where the thinking brain keep a check on the emotional brain in a normal situation. And whenever we are under stress, whenever we are under any kind of difficult time, and because in context of the screen reduction, and if I hope there are some parents as well in our audience, so for them, let's say we have this agreement with our teenager or young adult that after 11 p.m. we are not able to use the phone or use the screen, and then suddenly mom or dad woke up in the middle of the night and saw a dim light coming from the room, and they went inside and saw that their son was having something blanket and underneath using the phone. And at that time they felt being manipulated, they felt being that why my son is lying or daughter is lying. And so they may so their lower part go into fight and flight, you should not do that, why. And then the son also feeling shame and guilt. So I will, based on this model of the brain, I will be able to share some strategies for parents as well. If you found those kind of, and not only with the screen, but any situation where we found our children or teenager or young adult, they are doing something that were not acceptable, or they are making mistakes, how we help them to understand without being judged, without being punished, and without the main issue what I am seeing nowadays, that parents, they are desperately trying to help their children, but unfortunately at the cost of connecting with their children. We get so much focus on making them doing the right thing. We get so much focus on, if my son or my daughter is not able to listen to me in the house, how they can able to live a life in the real world. So I will be able to go over with this hand model of the brain, how as a parent, as a teacher, even as a friend, as a colleague, how you can help each other when you go through this difficult time. But I will give more example related to the screen addiction concept. So I already went through the thinking brain, decision making, impulse control, planning, executive functioning, lower emotional brain, fight and flight. And Dr. Dan Siegel say, whenever in that moment when, the child is the thinking brain, emotional brain is like this, and suddenly the mom and dad find out that, you were using the phone, and in that moment, Dr. Dan Siegel say, it flip the lid. In that moment, you are only acting through the lower part of the brain. And many times parents share with me that they have a lot of experience. They are trying to tell the right thing to their children and teenagers, but the more they are advise them, the more it's making them frustrated, because the part of the brain which is going to take the advice is already hijacked. So that is a flip the lid. When someone is under a stress, either a teenager, a young adult, or a grown up, whenever they are under a stress because of a failure, because of feeling embarrassed, because of they did anything that was not acceptable, because they got into an argument, they got into a broke up, all those situations, their lower part go into fire that much. Dr. Dan Siegel said that it hijacked thinking brain and flipped the lid. In that moment, only the emotion, the behavior that is coming from is the emotional part of the brain. So no matter how good advice parents are giving, it's adding more fuel to the emotional brain, and that is leading to more and more anger, more and more frustration. Either they start yelling, screaming in the middle of the night. We have many situations where parents say they have to call the police because things were getting worse. The neighbor have to call the police. I'm just telling you real life examples. Definitely I see the worst side of it, but when I talk in general with because of my social media, so a lot of time these are the situation where small things happen, and then everyone is yelling, screaming, blaming, and it's just a mess. because they both are acting through the lower part of the brain and not realizing how that fight and flight brain have hijacked the thinking brain. And that is not the moment to tell them what is right and wrong. That is not the moment to tell them, these are the advices. That is not the moment that the parents go into that rants, who used to go to school in bikes, who never had a car, who never went to McDonald's, no one ever celebrated our birthday, who threw us such a big party. How can we be so unappreciative, so spoiled? That's not the time to do it. Okay, so I want to be very, very mindful about these topics because again, I am doing this first time, but I'm assuming that there may be a lot of parents or a lot of the attendees or audience, either their parents might have grew up in a different culture and they are raising people here, or even not in a different culture, they may grew up in an environment where the punishment, we're being strict, we're having good discipline, all those things people have found very valuable, and those strategies might work for them. But when they are trying to implement to this era, this generation, this modern era, Gen Z, those strategies that worked for them might not be working now or even making things worse. So let me go over why, as a parent, it's very hard for us to keep doing things, although we are seeing that because of those I don't I will try not to use right or wrong parenting style, but I would say a conventional parenting styles are not working anymore. And although our teenager, our young adults are getting far and far from our parents, they are feeling more connected on social media and the virtual friends rather than feeling more connected with at home, because our parents, with all the great the wisdom, with the love, with the money, with all the expensive gifts, with the big birthday parties, at home we are not feeling that connected because the strategy that parents are using is conventional when our children and the teenager, they are growing up in this Gen Z era. So sometimes the teenager, young adult, they like my presentation, and sometimes they ask their parents, mama and papa, look, we were telling you, you never listen to us, but please listen to Dr. Zeshan. Look, he is saying the same thing. So you can feel free to use if you feel so, but use it more in an empathic and kind way. So let me share this and other research from Dr. Selma Freiberg. It's called Ghost in the Nursery. Okay, remember I told you, please have a coffee, but I'm going to ask a couple of questions. I shared with you first Dr. Dan Siegel, hand model of the brain. And now I'm sharing you with Ghost in the Nursery, Dr. Selma Freiberg. So Dr. Selma Freiberg say that parents, when they were children, the way they grew up, the practices that they have seen, either it happened to them directly or it happened to the people around them, the strictness, the disciplinary, and the, yes, very loving and caring parents. But many times when I talk to these parents who are no doctors, engineers, and I ask them this one question: have you ever felt being heard, being respected, and being understood by your parents? And many times the answer is no. They have been told what to do, and there are very less. One thing again, I will say again and again, I'm not saying they have done something wrong. I'm just saying things have changed. Um, Time has changed. One of my mentor gave me a really good example, and then I come back to this, and I might make you hungry as well a little bit. So one of my mentors, she gave me example. She said, when we were growing up, in Pakistan, some India, and South Asia or other countries, so our parents used to make, from a wheat. In Pakistan, we call it a paratha, where they make a bread with an oil. And it is, I mean, at that moment, it seems a lot of energy, a lot of calories, a lot of energy. So it was a good, healthy breakfast in the morning. And most of us, who grew up in that culture, grew up with that. And she said, that let's say now, if I want my child to eat that paratha and I force them, look at me, I grew up with this, look how successful I am, I'm a big doctor here, look, all those stuff. I'm just exaggerating a little bit as well to make it a little bit more funny. So she said, it's not going to work. But if we use the same wheat and make a pizza out of it, so we are not changing our core values, but we are adapting it, adjusting it because, it's a different time, it's a different generation. But sometime in a more with this concept, we just try to push those parathas in our throat. And when our kids don't eat, then we shame them, we guilt them, we make them unappreciative, spoiled, and all those stuff. So Dr. Salma Freiberg says the parents, the way they grew up as children, so all those memories growing up, now they are doctors, engineer, businesswoman, teacher, working mothers, staying home parents, whatever the concept is, all those memories, our brain forgets it, but our body remembers it. Let me say it one more time. All those memories, the way we grew up, now when we are grown up, becoming a parents, becoming, our brain forgets it, our body remembers it. And the moment we found out that our son or a daughter, he, she, or they, I want to be gender neutral in terms of my pronouns, he, she, or they are using a phone in the middle of the night without thinking, because all those memories are stored when we try to, you know, take risk, who tried to challenge our parents, who tried to do things, and when we got caught and how we were punished, how things were taken away. All those memories are stored where? In your body. So without thinking, they go in a big rage, start shaming, guilting, blaming, unspoiled, unappreciative. How can you do that? And all those things. Let me give you an example here, and I hope that will help a little bit what I'm trying to say. I was doing a presentation at a university, and after my presentation, one of colleague who's a psychologist came to me, and he said, Dr. Zishan, I have a daughter. She was high school or a college student at that time, and they were at a wedding. And she said that I was passing by and I overheard my daughter was telling her friends, I know how to make my mama fool, because she's a psychologist. She might have, unfortunately, might have heard some of my lectures where I talk about more listening, not punishing. And she said, I know, she's not going to punish me, so I know how to make her fool, how to act, and to get away from things. And so this mom told me, Dr. Zishan, that really hurt my feeling. She said, I grew up in a very strict parenting. I am a mom, a woman, and there was a lot of pressure to, stay home, but I stood up. I worked hard. I still have job, but I tried my best to not let my frustration from work, to not let my, all those income. I try my best to give time to my children, to play with them, to help them, not try to punish them. But look, this is where I am at. That my own children and teenagers, they are saying they know how to fool me. So I asked her, then what did you do? She said, then I told myself inside, no, I will tell her how a real mom will be. And then I started becoming more strict. I started becoming more, a regular conventional parent. And I said, then what happened? She said, gradually, my daughter, she started, not as friendly with me, not sharing things that she used to do. And, and I felt she was getting a little bit disconnected from me. But you tell me, how can I let my daughter to spoil and not be strict with her? So I told, I acknowledge, I appreciated, her for sharing the story with me and sharing, this experience. And I asked her, did you ever talk to your daughter? How did you feel when you overheard that statement? And she said, no. What's the point? She already know how to fool me. So what's the point? She's not going to listen. She said, no, I will show what the real mom is. And I said, I will humbly suggest you to please go to your daughter and tell her, that you have been trying so hard, and tell whatever you told me, the way you grew up as a woman, the so much hard work you're putting to make sure that you're a successful mother, you are a role model for her, and you are spending time. But it really hurt your feeling when you overheard what she said. And ask her, you know, I just wanted to share with you and I just want to talk to you. What do you think we can do it in together, that you don't have to fool me and I don't have to feel hurt? So the example I wanted to share it with you. So when that mom said in her mind that no, I will show how the real mom would be, at that time, she was acting because of her own childhood experiences that were stored in the body. And in the second, so it's a very harsh term, ghost, in the nursery, but basically they acted as a ghost in that situation. So when parents overreact to the children's situation, their misbehavior, their failure, because of their own childhood experiences, Dr. Salma Ferber called ghost in the nursery. Okay, so we have some little bit broader understanding, what I will share a couple of things moving forward. So now what are the bigger problem with screen addiction? There are a lot of things you don't need a child psychiatrist or a parenting coach to tell you. These are pretty obvious. We all know, when I talk to parents, they say, it's not about the screens or phone. It's just that the teenager, they can't stop. They eat there, they make friends there, they play video games. That's their social outing. So there is no, they have temper tantrum fines if screen are taken away. In my situation, sometime, as I mentioned, the police have to call because they got into so much agreement that, they were shouting and, there was such a bad situation. Parents label them antisocial, they have nothing to do, all those stuff. They are, they keep telling I am bored, and if you take screen away, they start getting frustrated. So these are all the very common, situation that we see. And I say them, this nowadays the screens are the most cheapest nannies, most cheapest babysitters, most cheapest friend. If you give this phone to a 2-month-old, 10-year-old, 40-year-old, or 80-year-old, the moment they have these things, they keep scrolling, and sometimes it's hours and hours, and they have no understanding. Sometimes, you are very frustrated the moment you go on TikTok, Instagram, or all those things. Hour pass by, and you sometimes even forget or numb, what you were going through. So So there are a couple of factors that make these phone screens, video game, and all those things addictive. First is there is an instant and intermittent gratification. In the past, when we were growing up, if we have to visit friend, we, make plan, but if there is raining, if in Pakistan, in India, people who grew up, sometimes electricity, sometimes other factors, we may not have the access to the friend. But here you have this phone, you have your friends on Instagram, Facebook, TikTok, all those stuff 24/7. And then you are posting a picture, or you're posting a video, you're posting a reel, you're posting a, feed, and some posts are getting more likes, some don't get more likes. So this is an intermittent kind of gratification. So we are always in a rush. The moment, we will post, on social media, you will see, okay, how many likes, how many comments. And then similarly, if one picture, one video, one post, one blog get more comments, so we are trying to make more like that. So it's a lot of intermittent gratification, instant gratification. The second thing is that it's a very safe space. In a real life, you don't say a lot of mean things on the face, but on social media, we have seen the way the cyberbullying is going on, the way, this online, things are going on. This is just unbelievable. People don't even think to say those things in front of you, but on the virtual is just unfortunately made so easier, because people feel safe saying those things. And even making friends is not as a lengthy process, because in real world, you want to know the other person, who they are, what their interests. You may want to spend some time before you make them friend. But in social media world, you may see that this person have some similar posts, some common friend, and we will make friends right away, because we know that if that person said anything, I can unfriend them. But in real life, if you have, someone, a bully friend, of someone who's mean to you, it's not that easy to unfriend them. So yes, we are living in this virtual bubble, is this artificial bubble of existence, that maybe we are feeling more happy in playing video game, achieving more and more success. But in real life, it's very hard for us to learn the skill set when we come across failure, when our friend, when we broke up in relationship, in friendship, when our friends would say something that is hurtful. And that's why nowadays we are seeing a lot of frustration tolerance, self-image issues, this suicidality, it's so much because of all this what we are doing on basis. Okay. So there are sense of belonging, escape from pressure, and so there are a lot of things that make it to, make it more addictive. Okay. So I have shared two things so far. One I shared in the beginning was hand model of the brain, and the second I share Dr. Selena Freiberg Ghost in the Nursery. And now I'm sharing a very important slide, and that's the main essence of my presentation. Remember in the beginning, I told you that the video game and screens and all these things are not bad itself. What make it bad? That where I will explain. So I strongly believe that there are 5 S's. Again, I'm warning you, if you don't have coffee or tea, please have it. It will help. I may ask a couple of more questions to just challenge your memory as well. Okay. So let me share you 5 S. So I strongly believe, and Dr. Dan Siegel also mentioned in his book, I believe Power of Showing Up, I think in that book. Similarly, there are other people who have shared the similar kind of concept, that every child and adult want to feel seen, want to feel safe, want to feel successful, want to feel soothed, and want to feel significant. Okay. Every child and adult want to feel seen, safe, successful, soothed, and significant. And there is nothing wrong in these things. These are pretty normal human behavior. So so the screen and the phone and the video game, they become toxic or addictive when our children, our teenagers, our adult get all those 5 S's only from their virtual platforms. As long as, and I will go over the family media plan, and how as a teenager, we can help our parents. Like as long as, let's say, young adult, high school, some are on summer break, and that's a common issue I have been coming over and over. The parents are bringing their young adults, college school, high school students, undergrad students, Dr. Zishan tell them, don't be on video game all the time, don't be on screens all the time. And then I tell them, making sure they are doing few things. They are going to sleep on time. You cannot expect a teenager or young adult when they don't have a school or college or university to wake up early in the morning. So as long as they are having a good enough number of hours of sleep consistently, so they are going to bed on time, maybe a little bit late, whatever the time they are waking up, they are having meals, they are having family time, they are having some physical activity, and they are having some outdoor activities with their friends and colleagues. And if they have any job or summer internship, as long as they are doing those things, and beside that they can enjoy playing video games. Sometimes that could be many hours in a day, sometimes few hours, as long as they are not getting all these five S's. And I will go over one by one, what these mean. They are not getting only from the screens. These screens are not toxic. These are not addictive to it. They become addictive when we are doing it at cost of not sleeping. Just again, want to be make sure the parent, I'm giving the message rightly to the parents. Sleeping doesn't mean going late to sleep. Sleep, what I'm referring sleep is having enough hour of sleep. In summertime, I have seen the night time may get a little bit late, and that is perfectly fine as long as they are getting enough hours and they are not missing anything. Let's say if they have an internship and they are doing something, they are not missing out on those things. Okay. So seen, safe, successful, suit, significant. So seen mean, so we all want to do things that make us feel seen. Like for example, I do a lot of presentation. I mean, that's not the only reason, but I'm very active on my social media. I post. I have my own YouTube. I have on my Facebook. I have my Instagram. So and I post these things. So I feel seen. So it helps me to keep doing those things. Safe, as I mentioned, that in real world you are not, people don't say these things, mean things, hurtful, say it maybe a little bit but not that much, and not so many people, random people are commenting, cyberbullying. And similarly the friendship I mentioned, in real world you think through, you take some time to make friends. In virtual world, you saw someone friend request come, they seem okay, and then we make them friend, and because if they say anything you can unfriend them. So it's a more safe space, virtual world. We feel more safe to make friends on the virtual world. Seems successful, when you, if when you post things, or when you play video games, you are reaching each level, so you are feeling successful. Soothing, as I mentioned, I may have a hard day, I come home and I, the moment I start scrolling my Instagram, what people are saying, I'm start watching some reels, I'm watching. So I even forget what the issue I was struggling because, and then hours pass by. So it is, these are very soothing. Significant, that when I'm just sharing my example, so hopefully that will help. When I post on the social media, people comments, they answer, they ask, this has been very helpful, these are my further questions, so you are feeling more significant. And these are the five S's that make you want to do things. So if you, let's say, if you are a basketball player, if you're a soccer player, if you are dancing, if you're a chess player, so all those things, the reason we want to do is because we want to, it's not one of the five S's, either seen, safe, successful, suit, significant. So in the screens, that's what I help parents. They become more addictive and toxic when our children and teenagers and young adults are only getting these five S's from the screen. So if we want our teenager and young adult to not use the screen, instead of taking away the phone, instead of snatching them, instead of, you cannot have this access for the whole month, instead of doing that, I will encourage you to find some offline activities that provide not not five S's, but maybe one S or two S, the activities that make that they want to do, that they enjoy it, that they make them happy, not what you think is good for my children career. It's important to have that as well, but making sure that you know what the child want to do. We bring some offline activities. These are these are some very some of the activities I just shared that we can do. Okay, so let's, as a parents of teenager, as you know, so there could be family dining, going to shopping together, movie time, volunteer activities in the community, inviting friends over, small party, so these are some offline activities, and there could be many. These are just some simple, coming to my brain early in the morning on Saturday without much coffee. I had a coffee, it's not working that much. So these are some activities that came right away. So American Academy of Pediatrics, they have this what is called it a family media plan, where I think I explained it to you before, that we sit with the parents. So in my office, I sit with the parents, I sit with a teenager, ask a teenager how much the phone or video game you want to play. That teenager may say 3 hours. The parent would say no, that he she or they use 5 hours. And then when I ask the teenager, is he she or they would say, yeah, sometime I use 5 hours. So the key is that we sit with them, ask the teenager, young adult, college student, what how much they want to play, ask with parents what are their requirements, and then make it simple. As long as sleeping is okay, they are eating, they have family time, they are doing outdoor activities, they are finishing their, if they are internship, if they have homework and assignment, if there are any pending, as long as they are finishing those things, they can have time, by making sure that all those things need to be off by certain time. And then we talk about, I think I have a slide, that if you, as a parent, or if you caught them um, violating, let's use that word, these plans, the how you react to it. So I help them, that it's not about how many hours they are using, it's about that as long as they are doing other things, either you bring some activities that make them feel seen, so significant. That could be taking them out, that could be going together, that could be spending time together, that could be whatever they are interested, or finding out somewhere to interested. So find out some more activities, because rather than just simply you cannot use this, and you cannot because you are taking away activities that are making them feel seen, soothed, significant, successful, without giving them some offline activities. And I have seen many times there is more anger, more irritability, more frustration, especially during this summer break, where the kids are home, the siblings are home. So we really need to work together to create those activities, offline activities, more and more, that provide seen, safe, soothed, significant, and successful. So these are the five-step approach that also helps in friendship, also help in coaching, also help in parenting, also help in relationship. So this is a very broad approach that is from Erickson Institute in Chicago. So here, so the situation, the same situation, let's say the parents, they had this family media plan that, you will do all those things, and after 11 p.m., there will be no phone, no screens. And then 1 a.m., as I mentioned earlier, the parents woke up and, suddenly found their son, their daughter using, underneath their blanket. So, so genuinely, as a human, you become angry, you become frustrated, you become betrayed, you become being manipulated, you become sorry, not become, sorry, you may feel all those things. Just like, remember the mother example that I shared with you, who felt, whose daughter, when the daughter said, I know how to make my mom fool. So definitely you felt, you feel all those feelings, and those are pretty normal human feelings. But one thing also remember, whenever we feel that way, remember which part of the brain get activated? The lower part of the brain. And the brain function is what? Fight and flight. So you may feel more angry, you may feel more frustrated, you may feel more, you want to yell, scream, blame, shame, why you did it, who you agreed up on this, all that stuff. So this model share, that if you want to help your friend, your colleague, um, and it can also help you with friendship as well, when your colleague or your friend, classmate or batchmate come to you that they are feeling sad, how you help them. Because the funny part is when they I have seen it many and many times. Someone comes to a friend, I'm feeling sad, I'm feeling this, and the friend would immediately with a good intention tell them it's okay, I have seen this thing, let's these things happen, let's go out, let's have some ice cream, let's do this, let's watch a movie. So and they start sharing even their own how they handle this, what they went through, or they started giving them advice and all those things, which is good. I'm not saying those are bad, but sometimes that friend sometimes is just coming not to get some solution, but sometimes just to being heard, just to have that safe space where they can feeling heard, understood, and validated. So that strategy also work with that as well. Okay, so the first step that I remind everyone to stay calm. Although your brain is frustrated, you're angry, you're frustrated, you are being hurt, painful, betrayed, all those things. But what this phenomena say, the more I stay calm, the better I am able to help the other person. Because if we start yelling, screaming, blaming, shaming, guilting, all those things, your lower part is on fire, their lower part is on fire, and all the great strategies, the thinking brain is already hijacked by the emotional brain, is not going to work. So the first thing is you remind yourself, the more I stay calm, the better I'm going to help this person, this friend, this my young adult. The second thing is we validate the feeling. It must be really hard or embarrassed that I found you using the phone when we agreed on. Um, and you may have thoughts, this person why they are using it, but I think when you do these steps, then they are more likely to listen to you anyhow. So validate the feeling. Third is collaboratively explore. Ask them, we agreed on not to use the phone at 11 p.m. Tell me a little bit what's going on. You may be thinking, this could be, this maybe not sleeping, maybe, just wanting to take advantage of when parents go to sleep. You may be right. So what you are thinking, but this strategy, remember, in that moment when you caught them, their thinking brain is not working. So these strategies are activating their thinking brain, so that when you do the fourth step, their thinking brain is a little bit already active to take your advice. So here I use the Dr. Z 10-minute rule, where we teach them, for 10 minutes, you are not going to give any advice, any suggestion, any what is right, what is wrong. You are just going to listen to them. And whatever they say, although how silly, how stupid, how frustrated, how illogical things they are saying it, you just repeat what they say. So, so it seemed like, the son or daughter may say, I was feeling sad, I was not sleeping, and that's why I'm using it. So you just repeat. It seemed like that, yes, we agreed on the 11 p.m., but tonight, because you were having difficult time, you thought, let me go on my phone. Tell me a little bit more. What are you watching? What are you doing? So what they are doing is not important, but this exploring and activating their brain, because the child and the teenager, young adult is seeing that, I'm on fault. But instead of what my parents used to do, shame, blame, guilt, I am going to take away your phone for a month, for a week, and you are losing these privileges, you are grounded, and all those things. Rather than doing that, they are trying to understand. And whatever the lame excuse, I'm just exaggerating just to make it a little bit more funny and silly as well. Whatever the lame excuse I'm giving, they are trying to ask more, and they are more curious to make sure that, why I'm using it. And then when you give them suggestion they're doing, then they are more likely to listen to you because you have listened to them. And then the fifth step is you reflect, the last time these things what happened, I did this strategy and it helped and feel more connected with my teenager. But if we go directly to doing, you should not do that. I will take away these things. If I don't tell you a lesson, that if I don't teach you a lesson, that's a very, very common phenomena that I hear. I am being more strict on my teenager, because I want them to be ready for the real world. Every other day, whenever I do presentation, these things come. One time, a college student came to me, my mama, yell and scream whenever I make mistake because she said, I want you to be get ready for the real world because in real world no one is going to forgive your mistakes. They will be harsh, they will be mean. So I want to make sure that I'm being more strict and being more disciplined so that you are ready for the real world. And similarly, I think last night or the night before, I was talking similar. We want to be more strict because my child say these kind of hurtful things, mean things. So I want to be more strict. I want to take this disciplinary action so that they learn. Let me give you my example, and that may help you a little bit what I'm trying to say. So, so I have a daughter. In the beginning, so I always try to put her to sleep. And so usual routine is I do my clinic. After clinic, I come home, brush her teeth, and then have a story time and put her to sleep. So in the beginning, I used to, and you noticed, that my practice get very busy in the evening time, but I intentionally try my best to not see patient after some time so that I can come home and spend some time with them. So in the beginning, when I used to come home, I used to brush her teeth, and she used to spit at my face. And as a South Asian culture, as a man, spitting at your face is a very disrespectful. It triggers a lot of somehow why, but it triggers a lot of emotions. And I want to be a good dad. I want to teach her some lesson, so I want to make sure that in my mind, if I don't teach her lesson, she will go out and spit on everyone's face. I need to teach her, this is not acceptable. And I told, so the simple phenomena is I told her, if you spit at my face, I'm not going to tell you the story time. And I still remember many nights that we our rooms are on the same floor, that she's crying in her room, kept saying, Papa, I'm not going to do it any next time, please come in my room and tell me a story, I can't sleep without you. And I am sitting in my room wanting to be a good and a strong dad and want to be more strong for my daughter so that she can learn a lesson. And she usually go to sleep by crying, and I was not feeling good what I was doing, but somehow I was thinking this is a hard thing. This is the how she is going to learn. If she is not going to learn, she might spitting up everywhere. Anyway, I'm exaggerating a little bit again. So then over time, I learned, that our love for our children should not be attached to their behavior. So, and then, but we have to teach them what is right and wrong. So moving forward, so, so so I went, she started spitting, and then I told her, this is not right. This is making me really mad, because we have to help them, what they are doing is wrong, what you're feeling, just like that mom story that I shared. And then I told her, but I am not going to take away your story time, because your story time is not earned. This is what I want to do with you, and there is nothing in this world that can attach my love, my time for you. So this is your time and this is yours, no matter how misbehavior you do. And gradually, when I used to tell the story during that time, I used to tell her, and then she was more able to listen. And now with our overtime, we started writing some stories because she got excited. She helped me, that we used to read a lot of stories together. Those are princess stories, but they were not real life, how we can help our teenager, our children, when they go through these emotions. So now, I wrote almost 6 stories. 3 are already on Amazon. So the first story that I wrote is that between me and her, I don't want to be your princess anymore. Anyhow, so just got so you can see, when we build, instead of fixing their behavior, when we focus on connection, we all learn and grow together. When we just focus on just fixing their behavior, just making them right and wrong, we are making them disconnected. We are making them waiting for parents to go to sleep so that they can start playing, so that they can start. We are waiting them not to come. We are wait. We want don't want to come home, or so that we can spend time with our friends. We want to stay in our room more because, that does not become a safe space. I hope I'm, adding some things to it. This is another good one, Dr. Thomas Boyce, Dandelion versus Orchid Kids. I will highly encourage you to look into these things. So my philosophy is connection before correction. Social media brain pathway, I think I shared you with the intermittent gratification, and why teenagers, young adults, they are into these things because they go through these phenomena which is identity versus role confusion, where what they are thinking is what career I want, what do I believe, who should I hang with, what should I do. So they are trying to explore their identity, they are trying to explore who they are, they are trying to test their limits, and these are all very normal, what a teenager and young adults go through. So, and what the parents, for them it's important, that their advices, their career. So it's a very disconnect with the things that are going in the teenager, young adult brain and what the parents are trying to say. And many times I have seen the parents would say, this was a lovely, caring, obedient child, and I don't know what have happened when he, she, or they went to high school, or why, what happened was, because their brain is going through this identity versus role confusion. They are thinking differently, they are trying to do things differently, their interests are different, they want to explore, they want to know who they are, rather than what their parents are telling what they want to do. And if the parents are not learning or not matching what's going on in their brain, so that is causing disconnection, that is causing more friction, that is causing more fights. And that's where the parents unfortunately are being finding more soothing, finding more connection on the virtual world, finding more connection in with their friends, finding more connection on the Instagram and all those things, and not at home. And that's where the home time, in many situations parents are requesting me, please ask my daughter, ask my son to at least have half an hour call at least on the weekly basis with me, or at home, at least spend 15-20 minutes with us and without this phone, because we have ruptured those relationships that much. So that's why the social media is becoming that much addictive. The other thing that parents are not recognizing, the people in the media industry, they have spending billions of dollars to make and you are seeing more and more. You are talking about some subject, you're talking about some brand, and when you go on your social media on Google, those similar kind of things are coming. If you Google something, if you search something, similar kind of ads are not coming in your phone, but also if the family phones as well. So this is what we call the brain hacking. And so so you can see, if you don't have to, the moment you open the phone, the thing that you were trying to find out last night, there were multiple ads everywhere. So definitely you're more likely to look into. So this is a brain hacking that is happening. And I think I don't have to go through, we all know what is this happening, the self image, the suicidality, depression, anxiety, self cutting, sleep issues, body image, less satisfaction, social isolation, anger outbursts, fear of missing out. All those things are happening, here and there. So this is, I have mentioned American Academy of Child and Adolescent Psychiatry. This is, a really good time. Common Sense Media, it's another good for physicians, for if there are physician, if you are in early career. So these are so they can tell you age appropriate apps, games, and different strategies to build, some tools. Similarly, American Academy of Pediatrics, I think I've talked about the family media plan, so that is a good resource as well. International Association for Child and Adolescent Psychiatry, they have a lot of resources in different languages, that are freely available there. Digital well-being apps, these are some, Apple Screen Time, Google Family Link, bar, these are some other good apps. These are some good books on the social media. These are some of the books that I mentioned: Power of Showing Up, Dr. Dan Siegel, Nonviolent Communication, Unconditional Parenting. And one more thing, let's say many times, if you are struggling, if you are feeling sad, down, so if you put these words in TikTok, don't just put depression, put depression treatment, put recovery. So when you use if you are feeling sad, lonely, suicidal, don't just um, put the word suicide, you put suicidal treatment, because when you put the treatment, recovery, help, then more likely the people, professionals might come up on your the fears otherwise if you put suicidality. So anyone who went through that, and no matter what their background, and no matter how in what bad situation they were when they were making the video, those kind of comes more and more, and that may make things more worse. So that's another awareness we want to do through this platform, that always write depression treatment, depression recovery, all those things, body image treatment, something on those lines. These are my books. I think I mentioned these. Some of them are available on readingwithdrz.com. So it's reading, reading with drzcom. So we have, those. These are more for younger children, but I'm hoping a lot of requests are coming to write books for the teenagers as well. So it's work in progress. Similarly, I do a lot of my YouTube. I do a lot on the teenagers as well. That is all with parenting with drzcom. So that has Instagram, but Facebook is the most active one. Yeah. So this is the QR code for. I think it will take you to, I believe, the Facebook page, and but the books are on readingwithdrz.com. But I'm really appreciative of this platform, and again, great. Thank you for the opportunity, and I'm willing and hope to have some question. Thank you.
Thank you so much, Dr. Zishan. We really appreciated this awesome session. Our audience, ranges like in a wide variety, so I'm sure it was applicable to all audience. So again, thank you so much. I really liked what you said about setting tech boundaries as like a team, not just enforcing the rules, but really trying to work together and trying to solve the issue that we turn to screens for what reason, where it's really important to solve the root cause. Like in my own family, we have a phone parking lot rule where like during meal times and bedtimes, we have this space for all of our phones, which we used to, rebel against. We didn't like it, but once our parents, explained to us like the importance of spending time with family and off the screens, we have our dedicated screen times like all day, but during those specific times, it's important to just take a break. So I really appreciate you framing it in that way. We just have a couple of questions here. What inspired you to pursue psychiatry in the first place and then later specialize in child and adolescent mental health?
So I grew up in a smaller town in Pakistan. I am the oldest among my eight siblings, and my dad owns a restaurant. So being the oldest one, I remember working at my dad's restaurant even before I attended the first grade. So my life journey in the beginning was, I used to go to school, and then work at a restaurant, weekends, evening shifts. And I have seen that, so after fifth grade, I have noticed that a lot of students, from my school, other school, they were dropping out. So I used to try my best. I was a good student, so getting a lot of respect in the community, because I was working. I was so a lot of people, and I was also a good cricket captain of my team as well. So a lot of people used to come, teach, tutor kids when I was in middle and high school. But one thing I was struggling a lot, no matter how hard I was trying, I was not able to help much. So when I went to medical school in Pakistan, Nishtar, so that's where I read a book where they describe a parenting methods of Dr. Haim Ginott. It's called Power of Listening. And so I realized that I was telling those parents and kids to go to school, and I was shaming them, I was guilting them, I was getting upset at them why they are unable to send them to school, and but I was not listening to them. What I meant was, so reflecting back, because I was in that situation, most of us, every family has seven or eight kids. Parents did not have a lot of money. So I remember on Eid or any big holidays, parents used to buy a big piece of cloth, and no matter how old are you, everyone has to wear the same color cloth. And let's say, if it is Eid, you have to get a haircut. The cheapest haircut was shaving your head. And, because the parents cannot afford, so most of them, we just shave head or pretty, so if you want, when you become a teenager, remember the identity versus role confusion. So you need to get a good haircut. You need to make sure you have matching shoes. You don't look like you are 7 year old and you are 13 year old. So, but in order to do that, you have a money. You need to have money your parents can't afford. So you are by default, pushed to start working at a very young age and earning. So I saw the power of peer pressure, and then I started listening to them, and understanding that it's not that they don't want to go to school. It's not that the parents don't want to send them. It's just these are the peer pressure. These are the facts, and I saw some comfort and soothing that angry and frustrated student I was, why I was unable to bring the change. And I saw in myself being more calm, and I also, when I started talking to the parents, they feel, rather than being more getting more sad and blame and shame why they are unable to send the school, I they felt being more understood. So that was a really good, powerful dynamic that I have seen in my med school. So when I came to US, so I was good in neurology, and we in Pakistan who did not have, I don't believe we had any child psychiatry program, even a not a child psychiatry program in Pakistan. So for me, I was thinking, should I go for a field that I'm good at? I have good scores, good clinical rotation in neurology, or should I want to explore something that I want to good at, but I don't have a skill set? A lot of people in the beginning, they said I have good scores in my USMLE. They were saying, it's very hard to become a child psychiatrist because you don't have that much knowledge about English, about school, the slangs, and all those things. But inside, I knew that I really enjoy and I really want to explore. So I opt for, so even so I did not apply to any specialty. I just applied to psychiatry. And in US, if you have to go to child psychiatry, you have to do the adult psychiatry. So even in my adult psychiatry, my statement was pretty obvious. So, and then, I did my psychiatry training in New York, and then was very lucky to got into Harvard child psychiatry, and I will finish there. So even in child psychiatry, so I was at Harvard. I still remember this is a family where mom was a professor at Harvard, dad was in MIT, or the other way around. And I was telling their child why it's important to spend time with their children. So then I learned the parenting is not about money, not about education. It's another skill set that you learn. So that's how I got into doing master and parent coaching, and I'm so happy what I'm doing. And so I think it's the important thing is you listen to your heart, and you keep exploring that makes you who you are, and you keep doing that excites you and motivates you. Thank you.
That's very impressive, and it's very meaningful that you were able to take your childhood experiences and sort of build upon that and get to where you are today. So, our next question is, what has been the most rewarding part of your career so far?
Many things in different ways. When I became the youngest president of Pakistani psychiatrists in US in 2023, and the reason I really want all of you to explore leadership opportunities in anywhere in which either you're in high school, you're in college, you're in whatever, it's very important to, explore leadership opportunities. So I have been teaching mentoring for many years. But when I became the president, the things that I was able to do that was very rewarding. It was not easy, but a couple of things I will mention. So at that time in 2023, Pakistan has 232 million population, and we have had only 5 child psychiatrists for the whole country. So I was able to collaborate with Pakistan Psychiatric Society, and we were able to write child psychiatric guidelines for the whole country. We wrote question. I was able to launch first autism center in Punjab. I was able to work some in red light area. I was able to visit this area where these sex workers, red light area, and their children were not getting educated because no one was able to take them. So I was able to collaborate and open a school in that street for these children of sex workers. I was able to bring my mentor from Harvard to Pakistan. Dr. Harrison, she came with me. We started first infant mental health. We just finished our research study where we are connecting mother and newborn babies. And we were able to help with Christian minorities in Pakistan. And then with that collaborations, we were able to collaborate with our Indian association, did some South Asian mental health. I think what I found the most meaningful was this uh, taking some steps that were out of my comfort zone, but I knew that was the right thing to do and kept doing it and kept exploring it. So that's where, one thing I will highly so one thing I'll, in leadership they teach us, if you know this is the right path, but it seems pretty dark and you don't know all the turns, you just keep going where the light shows you. So I think keep doing. Don't get paralyzed if things get difficult. Don't stop doing because of difficulties, and don't focus too much on the outcome. And I will share one analogy and then I will stop. I think in leadership they teach us, if let's say if someone is trying to break a rock by a hammer, and they are hitting the rock with the hammer 99 times, no crack, and 100 times they hit with the same hammer with the same force, but they see a crack. But that does not make the 99 hits wasted. It's just the crack was not there. So I really want, I'm really enjoying myself still now, appreciating the process, believing in myself, and believing in the power of efforts, and believing the outcome will happen on its own.
That's very nice. That analogy is honestly very helpful because we think that our efforts are all going to waste, but eventually, you start seeing or you start going forward in your path, and it's all worth it at the end. I think our last question for today is, how do you manage your work-life balance, especially while juggling clinical care, teaching, and coaching?
I think when everything comes with an intentionality. In leadership, they teach us there is no way you can give $1,000 to another person when you don't have $1,000 in your pocket. There is no way you can make other one happy unless you are happy in yourself what you're doing. So when you find meaning and when you take action towards what you makes you happy, so that make you feel more inspired and empowered for the people around you, and you're always open to learn, just like I shared example of my daughter and I. So you always learn from them, you always spend time with them. And I think the key thing in work life balance I would suggest is just giving time to the family and not attaching that time. Okay, when you spend that time, it will be a happy time. Just like, I was, in the beginning, I used to struggle, if I spend another hour in my clinic, I would have helped 3 or 4 ADHD children and their families earn a little bit more money rather than spending time with my child who is just spitting. So, so you don't focus on your family time, on their behavior, on the happiness. You just focus on time, be with them, no matter how. Because one thing I learned, the more I spend time with my family, the more they pull my hair, and that is the fun part of it. So we really, I think what I am seeing is that a lot of parents, they want to spend time, but they are realizing the more they spend time, because especially a lot of physicians parents who are outcome driven people, and when we are seeing we are spending 1 hour but it is causing more frustration, more anger, more yelling and screaming. So we think, okay, it's better I stay on my phone or in my office pretending I'm working. I'm just joking, pretending I'm working so that I don't be home, make don't things work. We need to be okay staying in the mess with our family. As long as we are okay doing that, we can achieve that balance.
That's a very good point. Honestly, as long as you're still family at the end of the day, so you have to
Yes.
live through that. So that is very helpful to know. Now, I think, yeah, that's all of our questions for today. Thank you so much, Dr. Zishan. Again, this was a really informative session, and we all really appreciated you taking your time to mentor us today. I'd love everyone to please give a warm thank you to Dr. Zishan in the chat box. All right.
Thank you. Thank you from my side. And I'm happy to be here in this space with all of you. I'm here. We are all here to help each other, to learn, to grow together. So please don't hesitate to reach out and let me know if anything else I can help and assist.
Thank you. Thank you so much. All
Thank you.
right, so our the link to the quiz for this session is now live, and again, you'll need a 70% or higher to pass and receive certification. And Thank you everyone for joining today's session. We look forward to seeing you in upcoming sessions as well. This concludes this week's shadowing. Thank you.
Take care. Bye.